So we look, as we go around the whole person approach, at 5 different aspects to that. It does include our traditional medical treatments, but they are not the main game, in fact, and it's the other aspects, the other 4 fingers that have greater power to retrain the nervous system and reduce pain. So this finger is about the mind-body connection, the interweaving of our thoughts and our emotions, our beliefs, and what's happening for us physically. The next finger is about connection, and this is connection to other people. It's about connection to the environment around us. It's about connection to a life purpose as well. And then next finger is about activity, particularly physical activity, and finally nutrition. And the whole person approach is very much the interweaving of all these things. How do we look at how any of them can contribute to pain on one hand, and on the other hand, how do we use change in any of those areas to address treatment of chronic pain?
Many people with long-term pain don't feel believed and get trapped in a never-ending loop of suffering. Changing direction brings hope. New ideas have revolutionised pain thinking and care. The focus is more on the whole person and less on the body structures. Persistent pain can change. It's not always an enduring disease or problem. First, getting assessed and ruling out anything dangerous is important. Then, it's time to shift focus, get informed, and manage pain from a broad, active perspective. Next, everyone can benefit from making the mind-body link. Drawing a timeline helps make sense of the emotional impact of life events before, during, and after the onset of pain. Addressing underlying depression or anxiety early is critical to reducing pain over time. People also say they feel isolated. Reconnecting to life makes a real difference. Finding new purpose and positive ongoing support benefits the recovery process. Sleep, rest, and physical activity habits all impact on function. Taking practical steps toward improving sleep, limiting rest, and establishing regular activity helps. In time, confidence builds. And trusting that the body's rhythms and limits can change brings a renewed sense of well-being. Last, good nutrition can't be ignored. Optimising our diets with plenty of natural food lets healthy gut bacteria thrive and brings less inflammation and pain. This is not just New Age thinking. These discoveries have shifted the world's understanding of how best to treat pain. Decreasing pain starts with knowing about pain and choosing to work on sustainable strategies. Knowledge about pain now and less pain in the future? Now that's a reward worth working for.
The first part of the whole person approach is the thumb, which is the biomedical section, and there are really 3 main areas within the medical treatments. There's surgery, there are nerve blocks, and medication. From a surgical perspective, it's not necessarily commonly helpful in long-term pain, but there are certainly some examples where an operation can help, and perhaps the best example might be someone having a hip replacement for pain in the hip area that's associated with osteoarthritis. But if you look at the whole population of people with chronic pain, really it would only be about 5% or 1 in 20 of those people with chronic pain where there is a simple surgical solution. The second type of medical treatments are nerve blocks and other injections. So these are sometimes very effective, particularly in the short term. But really the issue is that if nothing else is done, if it is only this injection approach, then by the time the block wears off, the person is no further ahead. The third part of the medical approach is using medication, and again, it's a little bit like the situation with the nerve blocks. Medication can work very effectively in the short term, but they run out of legs over the longer term.
We all accept medicine advances as knowledge grows. In treating chronic non-cancer pain, there's been too much focus on opioid medication and not enough on the most effective ways to improve pain and well-being. Most people taking opioids experience early gains, but it doesn't last. Taking more may seem to help at first, but in fact it makes matters worse. Along with well-known side effects, scientists have also discovered that people taking opioids often develop other problems. They're more likely to fall, have lower sex drive, lower immune function, and poorer quality sleep. There's also an increased risk of accidental overdose and death. We now know that opioids can quickly sensitise the nervous system and actually increase pain. Some people using opioids say it gives them a little bit of comfort, but that's not a reason to remain on them. There are also those who develop addiction, and this makes it very difficult to stop opioids, despite the harms. Knowledge changes. We now know that when it comes to chronic pain, use of these drugs often makes matters worse. Opioids are no longer recommended for chronic non-cancer pain. Instead, get support, get an active recovery plan, and get started.
I think that the painkillers and the anti-inflammatories and all that there's no doubt that they're having a detrimental effect on your organs. Like getting into these programs and exercising and it enabled me, I'm sure, to cut down on that sort of stuff.
I think for anyone who's been in chronic pain, it's a pretty much universal experience that you go through a system which really focuses on the body. But we know that in reality, what can be experienced in the mind, for example, strong emotions, can actually amplify or contribute to physical symptoms, including pain. And of course, we know that when people are in a lot of pain, it can have emotional effects too, and can contribute to depression and sadness, anger and frustration. We see that quite commonly. And in fact, that's how we really should look at chronic pain from a holistic perspective.
Well, I had 3 children and I had a 4th child, and I had a lot of time off work, and I went back to work early, than I had with the other children, so that I could have longer time off with my 4th child over a period of time, because I was a teacher and you could only have so much leave. And at the time I moved to a new school, the principal was a bit overpowering and demanding, not just to me but to the whole staff. And me trying to be brave and push through it all, eventually it came to a climax where my body said I couldn't deal with it any longer. And that's where it all started. That the tablets came, and then the mouth issue came too. The knowledge that's dispensed and taught here is that it's not just the pain, that maybe different people's stories has an impact on that pain at that particular time.
It's a huge amount of stress because I was divorced in 1995, 1996.
Yes.
Diagnosed with the arthritis 1997, 98.
Okay, well
that's really, and I'd recognise that and saw that,
yes,
just the stresses involved.
Is common.
Along.
That story is common. One of the challenges is how you can identify that and then use that treatment-wise. So one of the resources we've got on our website is a mind-body workbook that allows you to sort of go back and sort of track through that. That's one of the treatment suggestions here.
So it's not inevitable, but it's really common that when people are in chronic pain, you can get really quite depressed. When someone's quite depressed, you're not very motivated. You're much less likely to do things that can be helpful to manage pain effectively. It's really important, and it's what the research shows, that unless depression is treated effectively, chronic pain treatment is really difficult. So of course it's really important that if you have depression, that your depression is treated effectively.
You know, I think one of the things that's come out of this, you need to be in a good space with people around you and trying to motivate yourself to enjoy life. And from that, I think it just grows. And whether the pain actually lowers or disappears, I think my belief and hope is that it becomes irrelevant and that you can move on regardless and still get back into that same routine as what you used to be before the pain.
So as human beings, we're social creatures, aren't we? It's really important for all of us to feel connection with other people and with places. If someone is much more isolated or perhaps lonely, they're much more likely to get quite depressed or down, and in situations like that, the experience of pain can be much worse. It's interesting that some recent research has actually shown that if someone is much more socially isolated or excluded, the same brain areas light up when someone's actually experiencing physical pain.
I think a common theme here with the group is that a lot of people have become disconnected with their friendship groups because you're not available as much as you used to be, and people move on and do different things, and I guess they get sick of ringing and saying, do you want to do something, and you become a little bit unreliable. So you do need to have a good support there so you don't become too isolated.
That's where exercising and that comes into it, and coming here and with all your friends and that come here and you talk, and instead of just thinking about your problems, it takes your mind off them. Plus it gets you out and just sitting around home and gets you away from the wife and gives her a break too. It all helps to, yeah. If you just sit around thinking about your sore back all the time, you'll get really, really depressed about things. Because I got a little bit depressed about it, and then I started, like this exercise program, and it helps. You got to keep sort of moving.
One of the big factors for pain management for people is that they often become inactive when they've got pain for a long time. So we work on a whole range of active skills, and physical activity is one of them. And that can take whatever form that people want. So whether that's riding your bike or swimming or walking, it doesn't matter, but it is about having a look at where you're at the moment and coming to terms with what that level is. And we do a bit of exploring around that if you actually come to the clinic. And then once you've got that level set, and we set a goal around that activity, and then we usually slowly upgrade that to the level that you want it to be. It's quite exciting really, because people often think that pain is going to be worse when they exercise, and yet the opposite's true. So exercise is actually something that, it's a big word, it's called hypoalgesic. It actually makes the pain go down. But that's quite frightening, and it's a big jump for people to make in their mind that actually they can be active again after often quite a considerable period where they haven't moved very much. We are all different. In fact, some people do so much activity that they end up flaring up their pain in a major way. So for the people that are what we might call overdoers, or they might call themselves overdoers, they have to have a look at their activity patterns and really start to put the brakes on and divide it up a little bit more and find an activity pattern that means that they don't have those boom-bust kind of cycles. So that's one extreme. The other extreme are the people that might be resting too much And by resting too much, we'd actually say probably anything more than about 45 minutes a day of lying down is too much. So we do quite a bit of assessing around that, and people really have to come to grips with how many hours a day they're lying down. And sometimes that's an hour or 2 hours, but it can be 5 hours or 10 hours a day. And for those people, they have to slowly work on bringing those activity levels up bit by bit by bit. And we here at the clinic would help people support people with doing that, or people at home can do that themselves. And it's nice to see people go from not being able to move very much or frightened to move, and then bit by bit really getting that back and getting some sort of restoration of normal physical activity and function.
And I find when I'm exercising, you feel better straight away, As far as here and the contact with the people here, that contributes a lot.
When I first come here, I had trouble walking on the walker for probably more than 10 minutes, But over the time, I've slowly built myself up to, I can walk 7 Ks now.
Well, certain types of food cause your nervous system to become more sensitised, and there's a couple of reasons for this, but probably the most important, and the one we're just finding more and more out about, is that weight is associated with metaflammation. Metaflammation is a chronic low-grade inflammation of your system, and fat cells will contribute to that. Diets high in sugar, high in the wrong kind of fat, our westernised type of diet, it causes this low-grade inflammation, and inflammation in itself will cause pain. And there's also a lot of nasty cells released with inflammation, which are chemical drivers of pain. So our diet has changed radically in the last 100 years or so. We're eating a lot more cereal, and the types of food are different. We're eating less fish, we're not getting as much omega-3, so our balance of fats has changed. If we were eating from all of the food groups and really focusing on having a rainbow of colours, especially with our vegetables, we would be having quite a comprehensive diet. One of the really key things to remember is 5 and 2, which is 5 servings of veggies and 2 servings of fruit a day. And if you find that you're not able to get all the right balance from your normal diet, you may even want to include some supplements. That might be fish oil or some kind of omega-3 substitute, so fish oil or flaxseed oil. Yeah, well, caffeine is probably the most consumed drug in the world, and it can give you a bit of a pick-me-up. So a lot of people who have pain, chronic pain, or who have low mood like to have a coffee to pick them up. But caffeine, which is in coffee, tea, chocolate, energy drinks, and a whole range of other things that sometimes you wouldn't even realise, what it does is it winds or sensitises your nervous system again. It is a stimulant, it puts you on high alert, and that's often what we like about it, but it certainly can add to chronic pain. Just because you have chronic pain doesn't mean you have to throw out all the good things in life. If you have a well-balanced diet, you eat from the 5 food groups, you eat a rainbow of colours, you can still have some nice treats. You can have some dark chocolate, an occasional wine, have a coffee in the morning, and it will make a difference to your pain.